Hello, everyone, and welcome to this session. I'm Miriam Baltus. I'm your moderator for today. Anyone that has any questions from the online audience, please put them in Whova, and we will be happy to answer them at the end. I'm here with Bob Liu, our presenter. And Bob, if you are ready, go ahead.
All right. Hi, everyone. I'm Bob. Thanks for joining this session on enforcing consent in the FHIR API. So without further ado, I'll go ahead and begin. So this session, I'm the product manager at Google for Cloud Healthcare APIs. And in this one, I'm going to set us up with a scenario. Let's imagine we're at a hospital and we're trying to collect patient data to perform research. Of course, we want to have the proper consents so that the right people have access to that information. And importantly, we don't want anyone who doesn't have the right consents to be able to see that information. So this presentation will show us a small example, a toy example of how we can take patient consents as FHIR resources. And then once those FHIR resources are in the FHIR store, we can enforce those consents so that only the correct people are able to see the correct information. So in this toy example, we'll have just three personas. We'll have the provider, Dr. Elizabeth Blackwell, and two patients. You may have heard of them before, Jane Doe and John Doe. And I only have a few FHIR resources. Since this is a shorter talk, I'll keep things simple. But we have, of course, the two patient FHIR resources representing the two patients. We have a provider resource. And then those two patients have a few FHIR resources associated with them. So John Doe has two encounters. One is seen for chest pain, one is seen for depression, and also an observation where his blood pressure was noted to be 140/90. And then for Jane Doe, we similarly just have some FHIR resources. One encounter seen for syncope and observation of a blood pressure 120/80. So just some toy data for us to work with. Now, of course, consent, we generally think of consent for research purposes, things like that, but we can broaden that scope to be any purpose. It could be for treatment, emergency treatment, things like that. So in this initial scenario, I'll say that the patients have given consent to the provider for the purposes of treatment, so that the provider is allowed to see the patient data for the purposes of treatment. I'll switch over to the web demo, which gives us a web UI into the FHIR data and show how the provider might interact with the patient data. Let me just switch the screen over to the web demo. Okay, so I've shared my screen for the web demo. Is it coming up? Okay, there we go. All right, so this is just a web UI that's on top of the FHIR store, and we're able to read the FHIR resources through this web UI. Now let's pretend I'm the physician, Dr. Elizabeth Blackwell. I'm logging in, and you can think of this as a very simple UI. We're gonna do a patient everything operation to get our patient's mock data. So I'm gonna put, let's get John's information. And you'll notice I have some empty fields here where I can filter the type of resources and I can specify a purpose for which I'm getting that information. So for the purpose, again, let's put treatment. Since I'm the provider, I'm getting the blood pressure for treatment purposes. And then I'll grab those resources. So sorry, I put treat instead of treatment. Okay, so you can see with purpose treat, I'm able to see John's FHIR bundles. So there's a bunch of resources here, the ones that I mentioned. So as you can see, here's a resource for an encounter, a psychiatry encounter seen for depression. Here's another resource, the observation, blood pressure 140/90. So that is what we expect. Now let's say we're the physician, and instead of the purpose of treatment, let's say I want my purpose to be research. So of course, I would probably be using a different application, and that application will be indicating it's the purpose of research. But here I'm just going to manually type out that my purpose is research. So if I do research, I'll see a permission denied because my purpose does not match the consent for which the patient gave. All of this is built in to our FHIR API implementation. So I inserted the consent resources, and now the FHIR store knows that Dr. Elizabeth Blackwell can only see the FHIR resources for the treatment purpose. And I could put any other purpose in here besides treat, and I'll still get permission denied. So if I put marketing as a purpose, I still get permission denied. So that's an example of the initial scenario. Now let's create some additional consents to show how this interacts. Let's say John Doe now wants to give permission to the doctor to do some research. So let me switch back over to my slides. So this is the new scenario now. John, the patient, wants to let his provider use his observation data, his blood pressures, for research, and nothing more, just observations, because maybe he doesn't want it to be known that he doesn't want his sensitive mental health data to get out, but he's okay with the blood pressure being used for research. So I'll quickly show how we can create a new consent and enforce that new consent. Let me switch back over to the demo. So I'm back in the demo. Now I'm going to log in as the patient. This, again, is a very simple UI. It could be more complex. But here's our UI for creating a new consent resource in the FHIR store. So as John, I'm going to create a new consent, and I have all these fields that I can fill out. I'll walk through them in broad detail right now, but I actually have another session where I'll talk more specifically about the way a FHIR consent is defined. But I'll go through this quickly for now. So actors, who is allowed to see my data. So I'm going to select my provider, practitioner/Elizabeth. And then for the purpose, we're going to put research. So now we're allowing access to our data for research. Environment is a flexible thing. It could be where you're accessing data from or the VPN, things like that. And then for status, I'm going to choose active. That is, I want this consent to be enforced. And then for data categories, I said observation. So I'm allowing access to my observation. And let's also do patient, so the physician can also see my demographic information there as well. So directive, I can choose to do permit or deny. In this case, we're allowing access to our observation resources. So I'm going to choose permit. So I'm creating that consent. And as you can see, this is a consent FHIR resource. So it has various fields, and I'll go through this in more detail in my other consent presentation in 2 hours. But basically, all the information I just put into those drop-down boxes are encoded in this FHIR resource. So now the consent resource is in the FHIR store. I'm going to run an operation called apply consents. I'm logged in as the administrator. I'm basically running an operation that reads through all the consents and applies them and updates the access control model to enforce all the consents in the FHIR store. So I'm going to run this operation called apply consents. It's going through all the consent resources and enforcing them. So now that it's applied, I can sign out, and I'll go back in as the physician. And this time I'm going to try to get John's patient resources for research. And if you recall, just about 5 minutes ago, I tried to do the same thing, and I got a permission denied. But now John has allowed me to do this, so I should be able to see the information I want to. So I'm going to get resources for John's information for research, and you'll notice that I do get John's resources. And notably, I do not get all of the resources. I only get the patient and observation resource. So here's one resource. Let me make this bigger so it's a little bit more clear. So the first resource is John's patient resource. And then the second resource is his blood pressure. So just by doing a patient everything operation, I was able to get the information I was only allowed to see. Of course, there's a lot more resources we know that are in there, but the automatic enforcement did not allow me to get those resources. So as you can see, this allows the correct people to only see the correct information under the right context. And as a reminder, if I put my research as treat, I'll get the full list again, since I am allowed to see all those things. So here's the much larger batch of resources if I put my purpose as treat. And one more time, if I put marketing, which John has not given consent to, then I get a permission denied. So just to recap, we've seen how consents are enforced. I've created a new consent that updated the permission models to allow access only under the right conditions. All right, so that gives us an example of a access allowed consent. Let's try some other types of consents. So I'll switch back to my slides. Okay, so this is the use case we just covered. John let the physician use his observation data for research. And quickly, this is kind of the consent resource that was created based on John's intentions, and we read that and enforced that. Let's go into a new scenario where John wants to let his spouse, Jane, view his medical records. So in this case, I'll create a consent for Jane to see John's records for all purposes and all environments. All right, I'm going to switch over to the demo again. Okay, so I'm back in the demo. I'm going to pretend to be John again, and now I'm going to create a new consent. Importantly, let me show that right now, if I'm Jane, I cannot see John's information. So I'm logged in as Jane. I'm trying to get John's resources. I get permission denied because I don't have the consent. So let me go back to pretend to be John. I'm going to create a new consent for Jane, and I'm going to leave purpose blank, which will imply any purpose. And I'm going to say this is active. We're going to permit Jane to see our resources. I'm going to leave the data record mappings blank, which implies all of the patient resource, all of the resources that are connected to John's patient resources. So I'm creating this consent. Again, I get this FHIR resource, which contains all of that information. That's posted to the Google FHIR API. And I'll sign out. I'll go to the administrator and apply that consent and enforce those. So I've applied the consent. Now I'm going back to Jane, and I'm going to try to view my spouse, John's information. So now I'm Jane, and I'm going to look into John's resources. And now I'm able to see the information with John's consent. So that's how we take FHIR resource, consent resource, and automatically enforce that. I've shown two examples of allowing permission, but I want to show one final third example in the few minutes remaining. Let me switch back to the slides. Okay. So Jane can see everything, but let's say actually John wants to deny his spouse from seeing details about the psych encounter, since that's somewhat sensitive mental health data. I'm going to create a deny consent. So let me go back to the demo. Sorry, this is back to the slide. Let me go back to the demo. Okay, I'm back in the demo. Jane's looking at all of John's stuff. If you can see, Jane can see that John had this sensitive mental health encounter. So now I'm going to go back to John, and I'm going to deny access on that sensitive record. So I'm going to create a new consent.
Wait, you're going to create a new consent rather than creating an exception to the existing consent?
Yeah, so I'll get into that. There's a lot of different ways you could create sub-policies, how to allow and deny accesses interact. But in this case, I'm going to use the example of creating a new consent policy that says deny access for this specific record. So I'm going to create a new consent. Again, patient Jane, I say I'm going to pick deny here. And I'm going to deny this specific data record. So this is the URI for that psychiatry encounter/John-psych encounter. And now I'm going to create that consent. So I've created this deny consent. It's a FHIR resource posted. I'll go back and do the same thing where I apply that consent. And now that's being applied. Now I'll go back as Jane and try to view John's patient records. So as John, I'm viewing all these records, and now that instance has disappeared. So if you go here, I'm doing control find on depression, and that's no longer there. We just see the observation, the encounter for chest pain, but we don't see the encounter that's related to mental health.
Do you see the consent resource where it's refused permission?
Yes, because John has given. Oh yeah, so the question was, can Jane see the actual consent resource that says deny access? And given the instructions that I've posted into the FHIR API, Jane is allowed to see that, because basically we have a consent that says Jane is allowed to see everything of John's, so that includes the consents. And then we have another consent that says Jane is not allowed to see the mental health resource. So Jane is able to see everything except for that one specific psychiatry encounter resource. So that concludes the live demo portion. I will leave us with one last slide. Let me go back to the slide. We've seen a variety of ways where you can create consent resources to enforce consent in a variety of scenarios, including allow and denying access. And then I also want to note that our FHIR API does audit and track all these access attempts. So in addition to enforcement, we'll be able to provide users with access logs and when attempts were successful or denied. So in conclusion, we're working on a new set of features that allow you to store FHIR consents and enforce them automatically. In addition, we'll take those different consents and we'll resolve conflicts between them. For example, one consent said allow, but another one said deny. We'll resolve that conflict, and that is certainly subject to deeper discussion. And then we can provide audit logs based on your access attempts. And then with that, I'll give a final plug to a few remaining sessions that we have about the Google FHIR API and open the floor to any questions.
So we have just 1 minute left. So I think just one question at the moment, but everyone can approach you, right, Bob?
Good afternoon. Thank you for the session. How would you rescind, or like, if in terms of managing access, if someone already has access, if you want to take it away? I know you could allow it, deny. Is there a way to rescind access?
Yeah, so you could either delete the consent resource that says you're given permission. So for example, if John deleted that consent resource that said Jane is allowed access, then Jane would stop having access. The other way is to create a deny policy that says you're no longer allowed to see that. So either scenario works. There's also a field in the consent resource where you can specify the time period in which a consent policy is active. So you could also say this is only allowed until next year or something, and then after next year, that policy would expire, and then the access would be revoked. So there's a variety of ways to achieve that.
Okay, John, Bob, sorry, we're sorry out of time. I know that there are questions on Hoover as well, so hopefully you will get to there and answer those. And of course, here in the room, feel free to just walk up to Bob and ask him any questions that remain, or of course, join his next session where he dives deeper into this subject.
Absolutely.
Thank you, Bob.
Yep, I'll be around. Thank you very much.